Welcome to the Omni Dental Podcast.
It's really great to be here today.
Yeah, I'm excited for this one. Today, we are doing a deep dive into, well, a topic that's practically a universal rite of passage.
Oh, absolutely.
Like, if you haven't gone through it yourself, you almost certainly know someone who has. We're talking about the removal of wisdom teeth.
Right, the big one.
Exactly. It's one of those things that is just often shrouded in this mix of mystery and, let's be honest, a fair bit of anxiety.
Yeah, completely. I mean, it's a milestone procedure, right? It usually happens in that late teen or early 20s window. But because it actively involves oral surgery, they have a lot of fear about the unknown.
For sure.
They worry about the pain, the swelling, and specifically, the recovery time. I think we've all seen those videos online of people waking up from anesthesia acting totally loopy.
Oh, the viral videos, yeah.
Right, or those the chipmunk cheeks photos on social media. It just creates this whole narrative of suffering.
The dreaded chipmunk phase. And honestly, that is our mission for today.
Right.
We want to take a stack of sources, specifically the Wisdom Teeth Recovery Manual and the practice philosophy of Omni Dental and Med Spa over in Arlington Heights, Illinois.
Yep.
And we are just going to unpack it all. We want to move you, the listener, from that fear of the unknown into a place where you feel totally prepared.
And empowered, really.
Right, empowered. We want to turn this scary surgical procedure into just a manageable checklist.
I love that approach because when you break it down into biological mechanisms and simple to-do lists, it really becomes so much less daunting.
It's not a big, scary medical event anymore.
Exactly. It stops being this looming event and starts being a project that you just manage. And we have some really excellent source material to guide us today.
We do.
We're looking at advice straight from the team at Omni Dental and Med Spa, which is located at 305 E. Rand Road in Arlington Heights.
Right. And before we get into the nitty-gritty of, ice packs and mashed potatoes, and trust me, we have some very strong opinions on mashed potatoes today. Let's just briefly talk about who is actually giving this advice.
Good idea.
We're looking at the practice of Dr. Bilas Poles. The sources mention he has over a decade of experience, which, honestly, I always find reassuring.
Oh, experience definitely matters when you're talking about surgery.
You want someone who has seen it all.
Right. And what's fascinating about the source material regarding Omni Dental is the specific vibe they cultivate there.
Yeah, the vibe is different.
It is. It's not described as this cold clinical factory. The text uses words like patient first, environmentally conscious, and comfortable. I mean, they actually call themselves a dental and med spa.
Yeah, that med spa part really caught my eye. It implies a level of comfort that you just don't typically associate with getting a tooth pulled.
Not at all.
Usually you think of stark white walls, the smell of antiseptic, and those fluorescent lights that hum way too loud.
Yeah, it sounds stressful just talking about it, but they actually emphasize a relaxing environment to ensure the visit is stress-free. It's really a holistic approach.
How so?
Well, they recognize that the dental journey, which is what they call it, impacts your overall well-being. Think about it. If your cortisol levels, your stress hormones, are lower because the environment is soothing, your body is actually primed to heal better.
Oh, that makes total sense.
So the advice we're discussing today really comes from that perspective. It's not just about fixing a tooth, it's about taking care of the person attached to it.
I really love that.
Oh.
Okay, so let's unpack this recovery process. If you had to boil it down, if you had to pick the absolute most important thing in this entire recovery manual, what is the aha moment here?
Oh, that's easy. It all comes down to two words.
Okay.
The blood clot.
The blood clot. Okay, that sounds a little graphic and maybe a tiny bit gross, but tell me why that is the star of the show.
It is the absolute core mechanism of healing. In the source material, they explain that right after the surgery, your body starts forming this clot right at the surgical site.
Okay.
Now, we usually think of a scab or a clot as just a messy aftermath, right? Something you want to wipe away.
Yeah, like a nuisance.
But in this context, it is a biological shield. The manual specifically notes that it protects the bone and nerves underneath.
So it's basically like a natural bandage that your body just manufactures on the spot.
Precisely. You can think of it as the gatekeeper. Or even better, think of it as a scaffold.
A scaffold.
Yeah. If the clot stays in place, the bone and the nerves are covered, and your body can literally build new tissue underneath that protection.
Wow.
But if that clot is dislodged, or if it dissolves, you are suddenly exposing raw biology to the elements.
Okay, that really puts the stakes into perspective. It's not just about not making a mess. The entire recovery game plan, everything we were about to talk about regarding straws and food, is essentially a mission to protect this clot. If the clot stays, you heal. If it goes, you're in trouble.
That is the perfect way to frame it. Every rule, every single do and don't in the first 24 hours is designed to keep that little biological shield exactly where it belongs.
You're on guard duty.
You are essentially on guard duty for that clot. Yes.
Okay, let's zoom in on that critical zone then.
Mm-hmm.
The first 24 hours, this seems to be where the battle is won or lost.
It really is.
So surgery is done, you're sent home, maybe you're feeling a little groggy. What is actually happening? The source mentions some immediate sensations.
Right. And the text is very reassuring here because it normalizes the things that usually freak people out.
Like what?
It says swelling, pain, and bleeding are normal reactions in those first few hours.
That is really good to know because I think a lot of people see a little bit of blood in the sink and they just panic. They assume something has gone terribly wrong.
Exactly. And panic is the enemy here because panic raises your blood pressure.
Right.
Now, the dentist will usually place gauze over the site before you leave, and this isn't just to soak up blood. It's a tool. You need to bite down on it gently.
Why biting down? Why not just let it sit there and absorb things?
It's all about the pressure. Mechanical pressure actually helps the body signal the clotting factors to engage.
Like a tourniquet almost.
Sort of, yeah. It's like putting your thumb on a leak in a garden hose. You need that pressure to help that all-important clot form properly. So keep that gauze in place exactly as instructed.
Don't mess with it.
Right. Don't keep taking it out to check it every 2 minutes. Let it do its work.
Okay, so we have the gauze. We're applying pressure. What else is in our toolkit for day one? Because we mentioned the chipmunk look earlier, and swelling is a very real thing.
Ice packs. The manual is very specific about this. You want to use ice packs on your cheeks.
This is where you get that classic look, right? The strap wrapping around the head, holding the ice packs.
It's a classic for a reason,
Yeah.
but the strategy really matters here. You don't want to just freeze your face until it's completely numb. The source suggests using them for short intervals. Think 20 minutes on, 20 minutes off.
What's the biology behind that? Why do we need the intervals?
Well, you are trying to cause vasoconstriction. The cold makes your blood vessels shrink, which limits the amount of fluid and blood rushing to the injured area.
Which stops the swelling.
Exactly. But if you leave it on for too long, you can actually damage the tissue or even cause a rebound effect where the body sends more blood to warm it up. So intervals are key. You're just managing the inflammation before it gets out of hand.
Got it. Short intervals, controlled cooling, and then, of course, there are the medications.
Yes. The advice is very strict here. Take prescribed medication exactly as directed.
There's definitely a tendency for some people to try and be a hero, right? To power through the pain because they think they're being tough.
Oh, absolutely.
I'm completely guilty of that. I'll just be like, well, I'll take an ibuprofen later if it gets really, really bad.
A lot of people do that. But the source emphasizes that pain management allows for rest.
How so?
If you are in pain, your body releases stress hormones. And stress actually hinders your immune system. By managing the pain properly, you allow your body to relax and actually do its best healing work.
That makes a lot of sense.
So don't be a hero, be a healer. Take the meds.
Don't be a hero, be a healer. I like that. Okay, now let's talk about the don'ts. This is the anti-clot list. And I feel like this is where most people mess up because some of these daily habits are just so ingrained.
They really are. And the number one enemy on this list?
Let me guess.
The straw.
The straw. It just seems so innocent. You're sitting there thinking, I need to drink fluids. A straw makes it easier so I don't spill all over myself while my lip is numb. Why is the straw banned?
It comes down to physics, specifically the physics of suction.
Okay.
When you use a straw, you are creating a vacuum in your mouth. You physically lower the pressure inside your oral cavity to pull the liquid up, and that negative pressure is surprisingly strong.
Strong enough to actually move tissue.
Strong enough to literally vacuum the blood clot right out of the socket.
Oh, wow. Okay, when you visualize it like that, vacuuming the clot out that cures me of wanting to use a straw immediately,
Yeah.
that is a very visceral image.
It should be. The manual is explicit about this. The straw ban is absolute in the beginning. And honestly, that logic extends to other things, too.
Like what else?
The source notes that forceful rinsing or spitting hard are also extremely dangerous in this window.
Oh, I see. Because it's the same mechanical force. You're swishing liquid around violently, and that turbulence can dislodge the clot.
Exactly. You really have to treat your mouth like a construction zone where the concrete hasn't quite set yet.
No sudden movements.
Right. If you need to get rid of toothpaste or water, you just lean over the sink and let gravity do the work. The drool method.
The drool method. It's not elegant, but it saves the clot.
It saves the clot.
Speaking of sudden movements,
Mm.
the source also mentions activity levels.
Yes, no vigorous physical activity. This is definitely not the time to hit the gym, go for a run, or help your friend move a couch.
Is that just about keeping distracted, or is there a physical reason for that too?
It goes back to blood pressure again. If you get your heart rate up, your blood pressure naturally rises.
Right.
That increased pressure can actually push against the clot from the inside and cause the bleeding to restart.
So this is basically a medically sanctioned excuse to lie on the couch and binge watch TV.
It is a legitimate prescription for laziness. Take it. Your body is doing a marathon of healing in your jaw. You don't need to do a marathon with your legs.
I love it. Okay, so we keep talking about protecting the clot. What actually happens if we fail? The source mentions a very specific villain in this story called dry socket.
Ah, yes. The dreaded dry socket.
I've heard the term, but what actually is it? Is the socket just dry?
Well, based on the text, dry socket happens when that blood clot we've been talking about either dissolves too early or moves entirely. And what's left behind is exposed bone.
Oof. Exposed bone. That sounds incredibly painful.
It is. The symptoms are a massive increase in pain, often radiating up towards the ear or the eye. Yeah, it's very distinct from normal surgical soreness. It's a sharp, deep pain because the nerves in the bone are suddenly interacting with air and food and water. And the worst part is it usually hits a few days after surgery, right when you think you're in the clear.
Okay, we definitely want to avoid that. Aside from the straw ban and the no spitting rule, are there any other prevention tips in the manual?
Smoking. Smoking is a huge risk factor here.
Why is that?
It's a double whammy. First, the sucking motion of smoking is exactly like using a straw. It creates that dangerous suction.
Oh,
And second, the chemicals in the smoke, especially the nicotine, physically restrict blood flow to the gums. Less blood flow means slower healing and a much higher risk of the clot failing. So absolutely no smoking.
makes sense. And there is one more tip regarding positioning that I found really interesting in the source.
Positioning, like how you sit on the couch.
Know how you sleep. The manual suggests keeping your head slightly elevated while sleeping,
Oh, right. Yes, this is a great practical tip. It helps reduce swelling.
just by propping up.
Yeah, because if you lie perfectly flat, gravity allows fluid to pool in your head, and that naturally increases pressure and swelling. But keeping it elevated uses gravity to your advantage, helping that fluid drain away from the surgical site.
So just prop up an extra pillow. It sounds so simple, but it makes a big difference in how you look and feel the next morning.
Exactly. It's an easy win.
Okay, let's pivot to something I think literally everyone thinks about when they get oral surgery. Food. The mashed potato phase. We have established that we cannot use straws, but we do have to eat eventually. So what is actually on the menu?
The mashed potato phase is such a great name for it, and the source actually gives us a pretty appetizing list.
Nice.
Mashed potatoes, obviously, yogurt, soup, smoothies.
Smoothies are great, but I just have to interrupt. Remember, no straws. You have to spoon that smoothie.
Thank you for the reminder. Yes,
Yeah.
spoon the smoothie like it's a soup. The logic here is very straightforward. These foods are soft. They minimize the need for chewing.
His chewing hurts.
Chewing hurts. Yes, it puts mechanical stress on a sore jaw. But just as importantly, soft foods don't have sharp edges. You really don't want sharp crumbs poking around near an open wound.
So what are the forbidden foods then?
Anything crunchy or hard. Chips, nuts, raw carrots. Oh, those are all completely out.
Okay.
Think about a tortilla chip. When you chew it, it shatters into these little sharp shards. If one of those shards gets lodged in the healing socket,
Game over. That sounds excruciating.
it creates instant inflammation, and it can introduce bacteria deep into the wound. So texture is critical. But the source specifically mentions another category you need to avoid: spicy foods.
Spicy foods. Really? Why is that?
Chemical irritation. Spicy foods contain compounds like capsaicin that naturally cause inflammation.
Oh, I hadn't thought of that.
Think about it. If you put hot sauce on a cut on your arm, it would burn and turn red, right?
Definitely.
You are doing the exact same thing to your healing gums. It can seriously delay the healing process. So put the hot sauce away for a few days.
That makes perfect sense. It's an open wound. You have to treat it gently.
Exactly. And hydration is key too. Drink plenty of water again without a straw to keep the body flushed and hydrated. Tissue repair requires water. If you're dehydrated, everything just slows down.
Okay, so we survive day one. We've protected the clot. We ate our mashed potatoes. We slept with an extra pillow. Now we are moving into the recovery curve, day 2 and beyond. Do the rules change at this point?
They shift slightly. You essentially move from pure protection into careful maintenance. The source notes that after day one, hygiene transitions a bit, and this is where we introduce the warm saltwater rinse.
I feel like salt water is the answer to literally everything in dentistry.
It's an oldie but a goodie.
Hmm.
The text explains the benefit pretty clearly. It reduces bacteria and supports healing. It actually changes the pH balance of the mouth slightly to make it less hospitable for bugs.
Okay.
But the key word here is gentle. You aren't doing a vigorous mouthwash swish like you normally would. It is a gentle rinse.
So you're just kind of letting it roll around in your mouth.
Exactly. Let it bathe the area and then just let it drool out. No spitting.
Now, what about brushing? Because I know some people are terrified to put a toothbrush in their mouth after surgery. They think, I'll just skip it for 3 days to be safe.
That is a very bad idea. The source clarifies that yes, you absolutely still need to brush your teeth.
Okay.
The bacteria in your mouth do not take a vacation just because you had surgery. In fact, they love the extra blood and the soft food debris hanging around. However, you need to be a sniper.
A sniper?
Yes, very precise. Brush the other teeth, keep the rest of the mouth clean, but give the wound a wide berth. Do not brush directly on the extraction site. Just keep the neighborhood clean.
Okay, the source also mentioned a specific tool, an irrigation syringe. What is that about?
This is an interesting one. It's mentioned as a tool to help clean food debris from the area, specifically out of the socket itself once it starts to heal a bit more.
Right.
And this is a massive, but you should only use it if specifically instructed by the dentist.
Why is so much caution there?
Because if you use it too early or if you blast the water too hard, you are right back to the risk of dislodging the clot.
Oh, right.
It's a tool for a much later stage of healing, usually a week or so out. So don't just go freelance with the syringe. You have to wait for orders from Dr. Poles or your surgeon.
Got it. So if we follow all these rules, no straws, soft foods, saltwater rinses, what does the actual timeline look like? When do we start to feel normal again?
The text provides a very reassuring statistic here. It says that most patients actually feel better within just a few days. The swelling typically peaks around day 2 or day 3, and then it subsides.
And what about getting back to normal routines?
Usually within a week.
That's really not that long in the grand scheme of things.
It isn't. I mean, it feels like forever when your cheeks are puffy and all you want is a cheeseburger. But biologically, the mouth is incredibly fast at healing if you just give it the right conditions.
Why is it so fast?
It's highly vascular. That means there's lots of blood flow, which constantly brings oxygen and nutrients to repair the site.
So we've covered the what and the how. Let's circle back to the who. We mentioned Omnidental and MedSpa at the very top of the show.
Yeah.
If our listeners thinking, okay, I need this done, or I just need a dentist who understands this patient-first approach, where exactly do they operate?
Well, if you are in the northwest Chicago suburbs, this is your team. The source actually lists a very specific service area.
Let's hear it.
Obviously, Arlington Heights, where the main office is located at 305 E Rand Road. But they also serve Buffalo Grove, Palatine.
Prospect.
Yep, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, DePlain, and Elk Grove Village.
That is a pretty wide net across those northwest suburbs. So if you're in that cluster of towns, you are covered.
You are. And I want to go back to Dr. Bayless Pohl's philosophy for a second. The source mentions he specializes in dental injuries and emergencies, and that really stands out to me regarding wisdom teeth.
How so? Because wisdom teeth seem pretty routine compared to a full-blown emergency.
They are routine, yes, but they are still surgery. Knowing that your provider has deep expertise in complex dental situations and a precision-based approach, it just adds a whole layer of confidence.
That's true.
If he can handle trauma and unpredictable injuries, he can certainly handle a planned extraction with a really high degree of skill. It suggests a very steady hand.
Absolutely. And looking at their About Us section, they also highlight advanced technology.
They do. They specifically mention cutting-edge tools for precise diagnosis and efficient treatments.
Which is important.
Very. In dentistry, technology usually equals comfort. Better imaging means they know exactly where the roots are before they even start. Better tools mean less digging and less trauma to the tissue. And less trauma means less swelling and a much faster recovery for you.
And accessibility matters too. We actually have their contact info right here.
Yes, the number is 847-483-8833, and they are open Monday through Friday, 10 a.m. to 6 p.m. Which, honestly, that 10 a.m. start is really nice. It's not the crack of dawn.
It perfectly fits that relaxing vibe we talked about. You don't have to rush in at 7 a.m. while you're still half asleep and stressed out.
It really does.
So let's wrap this up. We have unpacked a whole lot today.
Yeah.
We've gone from the biology of blood clots to the literal physics of straws. If you had to summarize the main takeaway for someone who's staring down a wisdom tooth appointment next week, what is it?
Recovery is all about patience. It's about following instructions to protect the progress your body is already making. It really, truly boils down to protecting that blood clot.
The biological shield.
Yes, it's a partnership between you and your biology. The dentist does the surgery, but you are in charge of the healing environment. You are the project manager of your own recovery.
That is such a great way to put it. You are the project manager. And if you're in the Chicago area and you need a partner in that project, definitely check out Omni Dental and Med Spa. Whether it's wisdom teeth, cosmetic dentistry, or just a routine checkup, they really seem to have that balance of expertise and empathy figured out.
They do. And if I can just leave the listener with one final provocative thought today.
Please do. Here's where it always gets really interesting.
We so often think of our teeth as these separate little rocks in our mouth, right? Disconnected from the rest of us, like they are just spare parts.
Yeah, completely separate.
But this entire recovery process, the way the blood clot forms, the way nutrition impacts inflammation, the way rest dictates your healing speed, it really highlights how deeply interconnected your oral health is with the rest of your body.
That's so true.
A simple procedure like this is a vivid reminder of the body's complex, interconnected healing capability. When you heal your mouth, you are literally seeing your whole body's immune and repair systems in action.
That is a fascinating perspective. It's not just a tooth. It's a window into your overall health.
Exactly.
Well, on that note, we really hope this deep dive has made the prospect of wisdom teeth removal a little less scary and a lot more manageable for you. Thanks for listening.
Stay healthy, everyone.
Catch you next time.